Hey everyone, ready for this? It's like getting a cheat sheet, but for one of the most important studies in women's health. We're doing a deep dive on the Women's Health Initiative hormone therapy trials. We've
Dude,
got research papers, clinical data, the whole 9 yards, and we are going to break it all down for you.
absolutely. This is big stuff, tons of women, and it really changed how we deal with hormone therapy.
No pressure then.
Yeah. By the end of this deep dive, you'll know all about it, the good, the bad, and how to use it in your practice.
Okay, so quick recap. The WHI hormone therapy trials.
hmm
It was all about seeing if hormone therapy could, prevent those chronic diseases that women get after menopause. Kind of a big assumption back then, right?
It was. Back then, everyone just assumed that based on some older studies. But the WHI trials, they were different. They used a randomized controlled setup, and that's like the gold standard.
And we're talking about a massive group of women, 27,347 to be exact,
Wow.
age 50 to 79, all across the U.S.
Across 40 different centers, actually. And they were followed for years, both during and after the hormone therapy.
Okay, so let's break this down. What kind of hormone therapy were they even looking at?
So there are two main types. Some women, the ones who still had their uterus, got a combo of conjugated equine estrogens, that's CEE, and medroxyprogesterone acetate, or MPA.
hmm
Think of CEE as the estrogen part and MPA as the progestin.
Hold on, why the combo? Why not just estrogen on its own?
Good question. You see, for women who still have their uterus, just taking estrogen alone can up their risk for uterine cancer. Adding the progestin helps to counter that risk.
Makes sense. So two groups, two different treatments. What were they hoping to find?
The big one was coronary heart disease. Could hormone therapy actually prevent it? It's a leading cause of death for women. Big question mark. And of course, they were keeping a close eye on the risks too, especially breast cancer. That was a major concern.
So it's like they were looking for that balance. Do the good things outweigh the bad, especially for the heart?
Exactly. And they didn't just stop there. They tracked a bunch of other stuff: stroke, blood clots, colorectal cancer, endometrial cancer, hip fractures, even death from, any cause.
Yeah.
They combined all that into a global index.
Global index, meaning they weren't just like looking at each thing separately, but trying to see the overall impact. Right. Makes sense because our bodies are complicated.
Precisely. So ready for the results, because this is where it gets really interesting.
Hit me.
Okay, let's start with coronary heart disease, the main event. And here's the thing. Different results for the two groups.
What? Okay, so different for the women on the combo therapy versus the estrogen only. Tell me more.
Right. So the women on CEE and MPA, the combo, they didn't see that decrease in coronary heart disease risk. In fact, their risk was a bit higher compared to the placebo.
So no magic shield against heart disease for them.
No, not really. But, and this is important, the women on CEE alone, just estrogen, they actually showed a slightly lower risk of coronary heart disease.
Wow, really? So it might help the heart, but only estrogen alone. What about breast cancer then? That was a big worry.
Huge worry. And guess what? The findings for breast cancer were also different between the groups, but not in the way you'd think.
Okay, now I'm really curious.
So get this. The women on the combined therapy, the CEE and MPA, they actually had a higher risk of breast cancer compared to those on the placebo.
Whoa. I mean, that's a pretty big deal, right? So the combos seem to maybe even increase the risk. What about the estrogen-only group?
Night and day, honestly. They didn't show any increased risk during the study. And get this, long term, their risk actually went down.
Are you serious? That seems, I don't know, counterintuitive. People were worried about hormone therapy and breast cancer.
I know, right? It just goes to show how complicated all this is. The progestin, it seems to make a big difference. It's not just about hormones, period. It's the specific mix and how a woman's body reacts.
Fascinating. Okay, what about stroke risk?
Another crucial one. And unfortunately, both groups, combo and estrogen only, showed a higher risk of stroke compared to the placebo.
Okay, so that's something to think about for sure. So the good for the heart with estrogen alone might be balanced out by this stroke risk. That's a tough one.
You got it. It all comes down to that risk benefit thing, right? We
Right.
can't just look at one thing. We got to look at her history, her family, all of it to figure out what's right for her.
So not one size fits all at all. What about the other stuff they looked at, like blood clots, colorectal cancer, bone fractures? Anything interesting there?
Oh, yeah, definitely. Like with colorectal cancer, the combo therapy group, they actually had a lower risk, which is interesting because estrogen alone didn't do that.
Again, it's like the combination versus just estrogen are telling us totally different stories.
Totally. It's like that progestin is a major player there. Now, both types of hormone therapy did show a lower risk of hip fractures, which is a big deal as women get older, right?
Definitely. Especially with osteoporosis and all that. Was that a lasting effect or?
It was. Even after they stopped the therapy, still a lower risk. So that's a potential long-term plus to keep in mind.
Long-term benefits for bones, that's good. What about just like overall risk of dying from anything?
So neither therapy seemed to really change that. Not a fountain youth, but it didn't increase the risk either. It really seems like age plays a big role in all this, doesn't it?
When you,
Well, think about it. A woman's age, especially when it comes to heart health and hormone therapy, like those younger women in the study, the ones closer to starting menopause,
yeah, what about them?
they generally did better with hormone therapy, especially for their hearts. Think about it. Their bodies are going through huge changes, and the therapy might help smooth things out, protect their hearts in the process.
Interesting. So you're saying for women closer to menopause, the good stuff might outweigh the bad when it comes to their hearts, but that changes as they get further away from menopause.
Exactly. Younger women, their blood vessels might be more, receptive to the good effects of estrogen. But as women get older and those blood vessels have been through more, the risks, like stroke, might become more of a concern.
So timing is everything, huh? It's not just if you use hormone therapy, but when you start and when those benefits might start to fade.
Exactly. It's like trying to hit a moving target. And it highlights why, like we were saying, every woman is different. What works at 55 for one woman might not work for another at 55 or even for that same woman at 65.
So many factors. Age, health history, family history of diseases, lifestyle, the whole picture.
Right. That's where we, as providers, come in. We help them weigh the good and the bad based on their own situation, not just some general advice, shared decision making, open communication. That's what it's all about.
This is fascinating stuff already, and I feel like we've just scratched the surface of this study. There's so much more to unpack.
Oh, there's plenty more. We haven't even touched on things like diabetes risk, gallbladder disease, and of course, everyone's favorite hot flashes.
Oh, don't even get me started on hot flashes. Okay, we're definitely digging into all that next. Okay, so let's talk about those other health things you mentioned. Diabetes, for one. What did the WHI trials say about hormone therapy and diabetes risk?
Okay, so both types of hormone therapy, the combined CEE and MPA, and the CEE alone, they were linked to a lower risk of getting diabetes while they were in the study.
Really? That's surprising. You always hear about hormones maybe increasing diabetes risk, not making it better. Why is that?
It is interesting, right? We're still figuring out exactly why, but it seems like hormone therapy, at least in the short term, might actually help with insulin sensitivity and how the body uses glucose.
Okay, but there's a but, isn't there?
Yeah, there's always a but. This good effect on diabetes, it kind of disappeared once the women stopped the therapy.
So not a long-term solution, more like hitting the pause button on risk while they're on the hormones.
Yep, pretty much. Now, another thing is gallbladder disease. Both types of hormone therapy, they were linked to a higher risk of problems there.
Gallbladder trouble is not fun. Did that risk go down after stopping, at least?
It did get better, yeah. But for those on the combined CEE and MPA, that risk kind of stuck around a little, even after they stopped.
Another thing to think about when weighing the good and bad for each patient. Okay, let's talk about those hot flashes. A lot of women get great relief from hormone therapy for that, right? What did the WHI trials find?
Oh, absolutely. The women who had those moderate to severe hot flashes, the night sweats, both types of hormone therapy helped a lot.
That's got to be a big deal for those women, right? I mean, hot flashes and night sweats can really mess with their lives. Sleep, work, everything.
It's true, their quality of life really takes a hit. And actually, the study looked at that too. The women on the combined hormone therapy, they said they felt better overall physically, like they could move better, less pain, things like that.
So it's not just about preventing disease way down the line. It's about feeling good now. Did the women on CEE alone see those same quality of life improvements?
That's where it gets interesting. The CEE alone group, their results were kind of all over the place. Some women, yeah, they felt better, but others actually said it messed with their social life and their mood.
Right. Hormones can really impact your mood, not just your physical health. It's not always simple.
You got it. It's so important for women to really talk to their doctor, be honest about how they're feeling, physically and emotionally, so we can figure out the best way to help.
It's a conversation, not just checking boxes on a form, right?
Yeah.
Really understanding her experience, what matters to her, and what she's okay with risking.
Couldn't have said it better. And honestly, that's a huge takeaway from these WHI trials. Yeah, they taught us a lot, but they also showed us that hormone therapy isn't one size fits all. We have to look at the whole person.
And those needs, they change over time, right?
Mhm.
It's not just a one-and-done decision. It's an ongoing conversation.
Absolutely. And, as groundbreaking as these trials were, it's important to remember they had some limitations. No study is perfect,
Yeah.
right?
Of course not. So what are some limitations we should keep in mind when we look at these findings and try to use them with our patients?
Well, the first thing is that the trials used very specific doses and types of hormones, right? So we can't just assume these results apply to everything out there.
So we can't just say all hormone therapy is good or bad based on this one study.
Exactly. Nuance is important. Another thing is the women in the WHI trials, they were mostly healthy when they started. So we have to be careful about assuming these findings will be the same for women who have other health issues going on.
Yeah, like if they already have heart disease or diabetes, things like that, that could change things a lot.
Exactly. And last but not least, remember, the study relied on people remembering and reporting their own symptoms and stuff, which,
People forget things, right?
all the time, memories get fuzzy. That's just part of being human. It's just something else to keep in mind.
Okay, so limitations aside, there's no doubt these WHI trials were a game changer for hormone therapy, right?
Totally. They made everyone take a step back, look at the risks, and realize that personalized care is crucial.
It's a whole different ballgame now. We don't just assume it's right for everyone. We ask more questions, really listen, and tailor our recommendations.
Absolutely. That's what matters. Informed decisions, open communication between women and their doctors. There's no magic answer when it comes to menopause.
Every woman is different.
Uh-huh.
Every experience is different. It's about giving them the information they need to make the best choices for themselves. But before we wrap up, I got to ask you one more thing, something I've been wondering. We've talked a lot about what's good and what's bad about hormone therapy, but where do we go from here? What do the WHI trials really mean for how we handle this with our patients?
That's the million-dollar question, right? It's like the WHI trials, they kind of blew up that whole one-size-fits-all idea about menopause.
Yeah.
We learned that hormone therapy, whether to use it, what kind, how long it all has to be decided for each woman. No more just saying, here's the standard.
So really taking the time to understand her situation.
Exactly. Her age, how long it's been since menopause, family history, and of course, what she wants, what's important to her. It's all part of the decision. We have to weigh the good and bad for her specifically, not just follow some guideline blindly.
And we can't forget about quality of life, right? I mean, for some women, getting rid of hot flashes, being able to sleep again, that can be life-changing.
Absolutely. Quality of life matters. Those hot flashes, the night sweats, they can really mess someone up. Their sleep, their work, their relationships. We can't just ignore that. We have to treat it, even if it means like being extra careful about other risks.
That's such a balancing act,
Yeah.
managing symptoms, but also not causing other problems down the line. So if we had to pick just one big lesson from the WHI trials, what would it be?
That's a tough one. I think it's this. Hormone therapy, it's not automatically good or bad. It's a tool. It can help, but it also has risks. The key is using it smartly, carefully, and making sure it's what that woman needs and wants.
And that means we have to stay updated, right? Keep learning, be open to new research, and really talk to our patients.
100%. The WHI trials were a wake-up call, in a way. No easy answers. But when we have the knowledge, when we're paying attention, and when we're really focusing on each woman's needs, we can help them through menopause and help them make the right choices for themselves.
Couldn't have said it better. It's about empowering women, not just telling them what to do, and knowing that every woman's menopause experience is different. This has been great. Thank you so much for joining us.
My pleasure. Always happy to talk about this.
And to all our listeners, thanks for being here. Until next time, keep those questions coming, keep learning, and keep advocating for your health.